So, hello, dear friends. Welcome back to this new live session. Please let me know in the chat if I am out of if you can hear me or if you can see me fine. It is great to see you all again, all of you again here. Thank you very much for being part of this great community. I am Maria Fernanda, your host for today's session. We are gathered here with a group of exceptional young minds, students currently immersed in the e-learning program of classical homeopathy of Professor George Vithoulkas, or also graduated. Today, we will be delving into the real world experiences and challenges of these young practitioners. So get ready to be inspired, and maybe if this is your first time here, even discover a new perspective of the healing art of classical homeopathy. So I would like to say hello to Biraj, to Dr. Shivani, to Dr. Pramod, to Dr. Sima, to Dr. Barsha also, to Mujib, to Sima, to Dr. Sankit, and Sima says, yes, all good, dear Fair. Thank you very much, Dr. Sima. And also, hello, dear Nature. It is very nice to see you, all of you here. Before we jump into this conversation, remember that your thoughts and questions are very valuable for all of us, so you can write them in the chat. We will have a dynamic between the students. I will ask some questions of Materia Medica and Organon, and the first person who replies correctly will have 1 point to win a book of Levels of Health for free. So the more points you earn, the more chances you have to win. So now, without further ado, let's meet our wonderful guests. Our first guest is Berfin Duman from Turkey. She is a pharmacist from Mount Ararat. Her purpose is cure patients and publish articles that supports the efficacy of homeopathy. So I will invite to Berfin. Okay. Hello. Hello, dear Berfin. How are you? We cannot hear you. Let me see if I. No, we cannot. Yeah. You can speak now. Again. Very, very low. Very, very low. And no, we cannot hear you.
Can you hear me?
Yeah, now we can hear
Okay.
you fine. Yeah,
Okay.
very
Sorry.
good. Don't
Sorry.
worry. Don't worry. How are you, dear Berfin?
I'm fine. And how are you too?
Very good. Thank you very much. We right now we have 35 concurrent viewers. So thank you very much for to all of you that are watching. And if you can share the link to so more people can join. So we will continue with the presentations of our guest. Our next guest is Dr. Gulfisha Maru from Ahmedabad, India. She has 5 years in the field of classical homeopathy. Her passion is to serve humanity and spread knowledge with creativity. So please give a warm welcome to Dr. Gulfisha Maru. Hello, dear Gulfisha.
Hello, dear Maria. How are you?
Very good. Thank you very much. Thank you. Thank you for being here also.
Thank you.
We continue with our next guest is Dr. Nandeesh from Hospet, a small town in India. He has been practicing homeopathy for 5 years. He is a content creator on X, YouTube, and Instagram about health, and homeopathy. So let me invite to Dr. Nandeesh. Hello,
Hello, thank you.
how
Thank
are
you
you,
for
Dr.
inviting me to your
Nandeesh?
channel.
Sorry?
Thank you, I'm fine. Thank you for inviting me to your channel. Thank you.
Uh, Thanks to you. Thanks to you for accepting. So we all are very happy to for having you as a guest, and
My pleasure. Thanks.
we continue with our guest, Dr. Aditi from Cork, India. She has 4 years of dedicated practice in homeopathy. She received the IACH diploma in 2021. She would like to take classical homeopathy to every doorstep in Karnataka, India. So let me invite to Dr. Aditi. Hello, Dr. Aditi.
Hello, ma'am. Thank you for having me here.
Thanks to you. How are you?
I'm great. How are you?
Very good, also. Thank you. Thank you
I'm
very
really
much.
excited and looking forward for the session.
Very nice. So we continue with we will have a special guest from the H3 group, the H3 center. We are very happy because we have today two groups with us, and I will present two of the students of this group, but we have the pleasure and we have the privilege to have to all the students today. So thank you very much to all of you that are here with us today. I am going to present to Dr. Niha. She has been practicing homeopathy for the last 3 years. Her mission is to bring students in contact with the teachings of Professor Vithoulkas and spread classical homeopathy. So I am going to
So I
add to
am
the
going to
group.
add to the group. Hello, hello.
Hello. Yeah, because
Hello,
there
dear
was
friend.
a. Can you hear me fine?
Yes, yes, I can hear you.
Okay, because there is a echo.
Yes.
Ah, yeah. I, yeah, I think that the echo it was from Pratiksha, right? Yeah. Okay. Yeah. Now we don't hear the echo, so it is very good. Thank you. So we will continue also presenting another doctor from this wonderful group. I am very happy to see all the group again. So Dr. Pratiksha from Nasik, India. She has been assisting the H3 Center of Classical Homeopathy for 2 years, and her main mission is to spread Professor George Vithoulkas' teachings to all the corners of the country. So, hello, Dr. Pratiksha, please uh, make yeah. Thank you very much. Okay, so Dr. also Abhishek, currently a student. He is a current student of the MD in homeopathy in Bangalore. He has been practicing homeopathy for 4 years, and his goal is to see a world where homeopathy brings balance and beauty to people's life. I'll invite to Dr. Abhishek. Hello,
Hello,
Dr.
Dr.
Abhishek.
Maria. How are you?
Very good, thank you. How are you?
Yeah, fine, absolutely fine. Thank you to inviting for this session.
Very nice. Thank you for accepting to be being here. Um, our next our next guest is Dr. Snehal. She is a homeopathic consultant registered with the Arrow in Australia, and she practices homeopathy in Melbourne. She has been practicing homeopathy for 15 years, presently working as a lab assistant for a homeopathy lab. So I will invite Dr. Snehal. Hello, Snehal.
Hello, Maria. Thank you for the beautiful introduction. Looking forward to the session. Hello, everyone.
Very nice. Thank you. Thank you for being here. Thank you, everyone. So, I am very happy because all of us, all of you, will share a lot of interesting experiences today. So the dynamic will be the following: I will ask the questions to every person, and it will be the same question for each one of you, and you will have the exact time that it will be in the screen. For example, for the two first questions it will be 3 minutes, and for the last question 2 minutes. So the first one, it will be Dr. I will choose the name aleatorily. So the first one is Dr. Gulfisha. Okay, so I will let Dr. Gulfisha with the first question. The first question is, okay. Um, in Let me also remove, in a world where conventional medicine is so deeply ingrained, what arguments would you use to justify the application of classical homeopathy? So I will add the here the time, just a second, so you can, yeah, I let me mm, wait a minute. Okay, so you can start right now.
Okay. Conventional medicine has a different approach than homeopathy. Like they divide a person into different systems. For example, if a patient is having urticaria, they will send the patient to dermatologist. The same patient, if may develop bronchitis, they will send to pulmonologist, and so on. Where we homeopaths have the approach to treat patient as a whole. So we don't divide patient into the different systems, and we treat as a whole. Samuel Hahnemann has given very beautiful explanation what happens when two diseases meet in the body. In the aphorism number 38, 40, 43, 44, and 45, he beautifully explained the whole understanding and his experiences what happened in the body when two diseases meet. Further, Professor Vithoulkas has given the beautiful explanation in the levels of health, where we can understand a patient when he comes with three different diseases, whether it is urticaria, bronchitis, and thyroid together in the same patient. We can analyze, we can give cure, and we can make a prognosis that we can give cure to a patient or just palliate the disease. So we have these two theories, whether we can give cure, we can judge, we can make prognosis. And the conventional medicine has just divided the sick person into different systems, and here we are with the making unite the person and treating individually. Yeah, Maria.
Thank you very much, dear Gulfisha, for this wonderful reply. I would like here to say hello also to the people who is writing in the chat. The homeopath Birak Shah says that there was an echo. Yeah, thank you, Biraj. Seema Mahesh says Abhishek just became a father to a beautiful girl. Congratulations. Academy Vithoulkas says congratulations, Abhishek. I didn't read the comments that were the congratulations to Dr. Abhishek. Dr. Imran says namaste. Sorry. Okay, and Doctor also Nuyu Singh says congratulations, Abhishek. Okay, so with this interruption, I would like also to thank again to Dr. Gulfisha for your reply. We will have all the replies together, and then we can discuss at the end. Okay, so thank you very much, dear Gulfisha. The next
Thank
one.
you. Thank you.
Thank you. The next one will be Berfin Duman. So, hello, Berfin. You
Hello,
have,
Mary.
hello. So, you have the same question, and I will add also uh, the time. Okay.
Okay. First, would like to thank Maria Fernanda for her selfless efforts for spread classical Hahnemann homeopathy all over the world, and for answer. In general, I try to take severe cases where conventional medicine can only provide some relief from the symptoms. I tell my patients that in homeopathy, even diseases that traditional medicine cannot cure, and claim that cannot be cured are cured, depending on the patient's level of health, of course. I usually show them the published articles I wrote to convince them. When I talk about homeopathy in general, and the other people say homeopathy is a placebo, I show articles of my severe cases, and then they are amazed at the great miracles of the homeopathy. So I think articles are very important to show power of homeopathy. Thanks, Maria.
Thank you, dear Berfin. Thank you very much. You are very right. It is very important to have these published cases. So thank you very much. The next one is Dr. Nandeesh. So Dr. Nandeesh, okay.
Yes,
So I will start with the time.
there are two main things that we have to do to bring homeopathy to the forefront in this world. First thing is treating as much patients as we can with classical homeopathy. Second thing is writing the cases and publishing them in scientific journals. If both of these are properly done, then it's good enough. We need not justify homeopathy against conventional medicine or as an answer to conventional medicine. Conventional medicine has its own importance and has its own demerits. Homeopathy has its own importance and limitations. Most of the time, what we consider is conventional medicine, that is modern medicine, and homeopathy are intersectional. They are not. Modern medicine and homeopathy go parallel. Both have their own importances. So we need not justify to anyone that we are greater than allopathy or greater than conventional medicine, because when patients experience the treatment given by a homeopath, when patients get cured with the right remedies, they are the justification itself to everyone in the world, because those patients, the patients which come to me, or come to many younger homeopaths, they come after taking allopathic treatment. So it would be a challenge to us most of the time, and they would not believe us if we tell just by words that we can cure so and so condition. But if we put some efforts, take the case, and make some effort in prescribing the right remedy, the patient, when they observe the changes that happens in their body and mind after taking a right remedy, will will go and inform others about the merits of homeopathy. And according to my opinion, I think that would be the greater justification of homeopathy, treating the patients in a right classical way by making a deeper and scientific analysis, and also writing down the cases and trying to publish as much as cases in scientific journals. Thanks.
Thank you very much, Dr. Nandeesh. It is very interesting to see that now the mentality of the homeopaths is changing, and we are every day more interested in published cases and in the research. So thank you very much. The next one is Dr. Abhishek. So I will add Dr. Abhishek to the screen. Hello, Dr. Abhishek. You are you are receiving many congratulations in the chat. We cannot hear you. We cannot hear you.
Uh,
Yeah,
can you hear me now?
yeah.
Yeah, okay.
Now we can
Yeah,
hear you.
thank you.
Yeah.
Thanks a lot for everyone for the
Congratulations
thank you. Thank you once again.
for your for your daughter. So
Yes,
I will I will add the clock to the screen, and
yes.
you can share your okay your reply right now.
Okay. So now, so we all know that the conventional medicine has certain limitation by itself. So that is very deeply seen in chronic autoimmune cases like psoriasis, uh, any kind of autoimmune diseases, rheumatoid arthritis, and so on. Still today, most of the treatment is based on age-old corticosteroids, which blocks the inflammation. Nothing more than that. So yes, this everyone knows that homeopathy, people prefer homeopathy because there's no much cure or even no much betterment also sometimes. Even the quality of life is, there's no big difference even after taking corticosteroids or even immunomodulators. So this we have a bigger upper hand in treating. Even the public is very well aware of this, that yes, homeopathy can cure or try to cure chronic diseases. Okay. Now, I would like to tell one more thing is, even we are not behind in treating acute diseases. Conventionally it was said that yeah, acute homeopathy cannot do much, because today we are seeing a pandemic of what big pandemic of drug resistance. Okay, today, because kids, they give a lot of antibiotics to kids, and they end up having recurrent acutes and followed by a chronic disease. So this is a very well known thing now, that if you give a lot of antibiotics, your gut bacteria gets affected, and because of this, there is sub inflammation, and there is even changes seen in the epigenetics level, and then followed by genetics. Then you can have diseases like diabetes, dyslipidemia, hypertension, cardiovascular diseases. So these are all because of what abuse of antibiotics. So we are very bigger upper hand in treating even acutes, if you because and that is only, I think, possible by classical homeopathy, because the way we deal cases are really amazing. Okay, so this provides a beautiful thing to treat uh, acute cases. So here we are really preventing a big possibility of what a bigger chronic disorders. So I think classical homeopathy plays a very big role in preventing a chronic disease by treating acutes. Yeah, that's it, Maria. Thank you.
Thank you. Thanks to you, dear dear Dr. Abhishek. It is very important also what you are sharing with us. And it is very important to see the preparation of the young homeopaths, like you said, with all the background to can explain these arguments to the patients and to the world. So thank you very much. The next one is Dr. Aditi. So I am going to add Dr. Aditi to the screen. Okay. Mm, yeah, now we can. Okay, Dr. Aditi, so you have 3 minutes. Um, sorry, we cannot hear you, Dr. Aditi. We cannot hear you. Okay, we are going to go to Dr. Aditi next after Dr. Niha and Dr. Pratiksha. I will add them to the screen.
Can you
Yeah,
hear me, ma'am?
yeah,
Okay, is it better? Okay,
yeah.
yeah. Thank you for the opportunity. So, uh,
Thanks to you. Thanks to you for being here.
yeah. So my friends have already spoken about the limitations of the use of homeopathy and then the conventional medicine. I would like to begin by saying that the value of conventional medicine or the conventional methods can never be lost, especially the specialties like emergency medicine, palliative medicine, surgery. These things can never be denied when deemed necessary. But the context of use must be more appropriate. So homeopathy is a therapeutic system where we are aiming to re-establish the body's, mental, emotional, and physical balance. Our main advantage over conventional medicine is that the conventional method only targets the symptoms. It's a mere symptomatic approach, while homeopathy provides a more holistic and individualized approach. So we consider when we study a case, we take into consideration an individual's symptoms. Although the disease phenotype may be the same, we study the case and incorporate the classical homeopathic principles, and we employ a remedy which is tailored to each person. This is what the scientific research now is saying, that there's a need for personalized medicine. And the second point we have over conventional merit over conventional medicine is that there's like literally no medicine where it uses suppressive therapies to just remove symptoms. We, on the other hand, we homeopaths try to introduce a remedy and strengthen the defensive mechanism to cure itself. And also another added advantage of homeopathy is that one medicine can serve almost many symptoms. In conventional medicine, if there's flu and then there's fever, there's two different medications for the same. But for in homeopathy, it's like we give same medicine for almost all the symptoms. And there's also a very big misconception that homeopathy is very slow, and it's I feel that it's a very big misconception, because in my own personal experience, I have seen homeopathy acting more faster than any other systems of medicine, especially in acutes and fevers. So this also merits as a major advantage over conventional medicine. And in my own personal experience, I've seen that for especially terminally ill cases like cancer, uh, uh, they provide a lot of harmful drugs, and there's a lot of side effects, and the general condition deteriorates in conventional medicine. But we homeopaths, and it's really been my personal experience also when I say this, we provide a more painless and more conscious death, and which is more gentle. This is the best that we can achieve in a terminally ill patient. And above all else, a homeopath can single-handedly handle almost all the specialities. When it comes to conventional medicine, there's a specialist for ENT, there's a specialist for orthopedic, there's a specialist for gastroenterology. But as a homeopath, we can deal, if we are enough equipped and if we have enough expertise, we can deal with pretty much any condition. So yeah, that's all.
Thank you very much. I really would like to tell to the people who is watching that this passion for homeopathy, this when you are saying and when you are trying to give your arguments, it is impossible to not get passionate. So thank you very much, dear Dr. Aditi. Your answer is very interesting, and thank you very much. We will go to Dr. Niha and Dr. Pratiksha. I will add them. Hello, can you hear me? Let me I think, yeah, now we can hear you.
Okay.
There is a echo again.
Now you can hear me?
Yeah, yeah,
Okay.
I can hear you, but there is a echo for me. Maybe someone has the video on other computer.
Can you switch that off? Wait. No, no. Okay.
Okay,
Is
so I will
is
ask.
it okay?
Yeah, it is good. And
Okay.
no, we still hear the echo. Okay.
Okay, now is it okay?
You can
You can
start.
hear me? You
Okay.
can hear me?
We can hear you. Yeah.
Okay.
Yeah. Okay. So you have. Let me add the. You have three.
Okay. Well, I would like to start this with one of the most famous quote by Professor George Vithoulkas. The idea of practicing medicine is to bring happiness to the people. And I think homeopathy is the only modality which has the ability to bring happiness to a soul who has lost his happiness. And whereas conventional medicine will only disappear the symptoms or will only demolish the symptoms or it will only suppress the case, while as homeopathy can touch the deeper organism of the human beings. Diseases during the time of Kent and Hahnemann were not much deep-seated chronic cases, while as now we are dealing with much more chronic cases like multiple sclerosis, Parkinson diseases, and many more. There are many more deep-seated chronic cases. So to touch these deep-seated chronic cases, we need the correct treatment of classical homeopathy, which means which has been mentioned in the textbook of Organon of Medicine by Hahnemann, which means we need to wait sufficiently with giving single dose and with minimum dose, single remedy and minimum dose. And homeopathy can touch the deeper organism of the patient. That's all, dear fair. Thank you so much.
Thanks. Thanks to you. And we still hear the echo, but I will ask to Pratisha to also give her reply, starting. Uh,
Okay, I just want to mention that there are many misconceptions which people are carrying with them about the different system of medicine. So, as a physician, it's our duty that whenever patient come to us, we have to explain him that how our homeopathic system of medicine acts. So at the beginning of the treatment, we must able to differentiate them that how conventional medicine, when people goes to that conventional means allopathic doctor, they for the multiple system disorder they refer to multiple specialist doctor, and in homeopathy we consider the patient as a whole and on that basis we prescribe him a similimum. then what I feel that at the beginning of the treatment we have to explain them that how homeopathic cure take place, because many a times it happen in our practice that after during the after first prescription we see a reaction which seems to be beautiful as per our principle, but for patient it is a worst reaction which occur. So we have to give this idea at the beginning of the treatment that what are the possibility which occur during our treatment. So if we tell this in the beginning, then patient have that patience to deal with the reaction which occur. Then what I feel that what we learn from our professor that according to the hierarchy or a level of health we must able to judge that what when patient come to us that in which group the patient is belonging, because many a time it's happened that at the starting of the treatment only we stop the medication, conventional medication. So according to when if the patient belonging to the lower group, for example patient having a history of convulsion, we did not have to stop the anti-epileptic immediately. As per the improvement we see, or simultaneously we can taper the dose of the conventional medicine. So these are the things we need to consider or we need to keep in our mind, and we need to explain this all in the beginning of the treatment. And what I feel that we are lacking in documentation. So we need to keep a record of our curative cases, and we have to put forward these cases for a medical organization or for a research publication. So this is the strongest evidence to prove the effectiveness of our classical homeopathy. That's all.
Wonderful.
Wonderful.
Thank you very much, dear Dr. Pratiksha, for this reply. I would like to invite to Dr. Snehal. Sorry, we have a request from from Maria Karanopoulou that please do not speak fast. So I understand that all of us are very passionate, and all of us, when we speak about homeopathy, we can be passionate and we can start to speak fast. But I would like to say this to all of in favor of all of the people that is hearing to us right now. So I am going to add to Snihal to the screen. Thank you very much, Dr. Pratiksha. Okay, so Nihal, you have 3 minutes. Okay, let me add the screen. Starting now.
Yeah, thank you, Maria. And before I start answering this question, I'll have a big thank you for my e-learning group, because they were the one who introduced me to International Academy of Classical Homeopathy. So what I believe is, our work speaks more than the putting any argument, and every therapy has some or the other limitations. But I'll just put few points as per my clinical experience. So I have recently seen that people are becoming very much aware about what what choices they need to have a holistic health, especially the parents of young families. They are really becoming aware about the health and what kind of treatment they need to use for their kids, the long term effects of conventional medicines. There have been a lot of families who prefer to use homeopathy as first aid for fever, for cold, cough, allergies, everything. Then, second big step, what I have observed, especially here in Melbourne, is that I'm getting a lot of references from general physicians, practitioners. So, because they are quite aware about the limitations they have for the treatment of skin diseases, eczema, allergies. So that also indicates that the world is opening up there too. They are also open to homeopathy. And so I just believe that we can do our work and then spread awareness about how homeopathy works, and that's how we can help to spread homeopathy everywhere. And once people become aware, they spread the word out, and that's my clinical experience, that everyone is more of, the references and things, and they help to reach out and increase the number of people who believe in homeopathy. And if you treat one of the people in a family, one person in a family, automatically whole family comes to, because they get that kind of confidence that, oh yeah, homeopathy can help me with first aid, with everything. It's not a slow therapy. It definitely helps a lot in acutes as well as in the chronic diseases. Thank you, Maria.
Thanks to you, dear Snehal. I am sure that all the people that is hearing to us right now is finding your answers very helpful, very interesting, very insightful. So thank you very much for this round, for this first round of this live session. Thank you. And right now, I am going to start also with the dynamic about the questions for win a book of levels of health. So the question is, this is a question for the audience that are in the chat right now. The first question is, remedy that has a wide range of skin conditions, especially on the scalp. Professor Vithoulkas writes in the book The Chele Seminars, we see a child who is born with a very strong skin eruptions, and on top of the head she has thick crusts. What remedy does this make you think of? So to all the people who would like to win a book of levels of health, you can write on the chat, you can write your answers, and the first person who can write the remedy correctly, that person will have 1 point. Okay, so this was the first round of this session. Maria Koranopoulos says Berfin is a pharmacist and diploma holder of IACH. A lot of congratulations to Dr. Abhishek. It says Nilay, hello everybody, greetings from Turkey. Hello there, dear Nilay. Dr. Shivani says congratulations. Pramod Lanki says students who they are trained under Professor Vithoulkas, they become expert in their practices. You are right, Pramod. Edip Ser says, hi, Berfin. Nitin Thakur says, congratulations. Rosie Setia says, hi, everyone. And Dr. Pramod says, hello, dear Niha and Pratiksha. So I will let the participants to can answer this first question, and we are going to go to the second round of this live session. So the next question is, could you share a challenging case from your clinical experience during the e-learning program in a concise 3-minute speech that was particularly instructive for you? And please, I would like to invite to Dr. Aditi to this second round of the live session. Hello, Dr. Aditi. Hello.
For
So you can start now.
For me personally, learning under Dr. Seema ma'am and Mahesh sir has been really great to be able to incorporate whatever I have been learning in e-learning program more practically in the clinical setup. So for me, there are many cases that I've seen, and really felt overwhelmed that homeopathy can do as much as what conventional medicine couldn't do. One such a case that I came across is a case of Bell's palsy. I would say in a 8-year-old, he was given conventional medicine and he was even tried with Ayurvedic treatment, Siddha treatment, and nothing worked for about 6 months. So, as you all know, Bell's palsy is a condition which can auto resolve, but in spite of it taking 6 months and taking conventional medicine and also Ayurvedic treatment and other forms of alternative medicine, there's not much improvement. So the patient came to me with he had lost hope, basically, that he could laugh as everybody else, and he could it really impacted him a lot that Bell's palsy was there for quite some time. After employing the principles that I had learned in e-learning program, and of course from whatever I've learned from my mentors, we saw drastic improvement within like 2 to 3 months. Completely, the Bell's palsy was cured. So what I would like to say is that it's not just simply treating mere symptoms. We actually got to the depth of the problem, where we identified the reason why he was developing Bell's palsy, one-sided Bell's palsy, was he was feeling very forsaken, which the conventional medicine could not really touch. They were just treating the symptoms of Bell's palsy. But with homeopathy and also with the principles, I would say, I could get down to the root cause of the problem, and I actually did not consider, you know, not all the symptoms, I would say, but just by identifying the root cause and putting into place the other symptoms, either the physical generals or the mental generals, one dose of single similumum could literally bring out the person from Bell's palsy. So for me, I'm just a beginner, and such small cures is what motivates me. So this was one of the cases that I would like to share.
Thank you. Thank you very much, Dr. Aditi. I can imagine that have to Dr. Sima and to Dr. Mahesh as a mentors is a great gift. So you are very fortunate to have them as mentors. And thank you very much for what you share with us. The next one, I would like to invite to Berfin to give, please, her answer, and you can you can start now.
I had a 9 years old patient with erythematosus bullosa. The other name we say butterfly disease. When she was born, she had no skin on her legs and her legs were bleeding. At the slightest blow, the legs would hurt and bleed, and it was very itchy. The situation got worse after his parents divorced. While talking to the girl, she mentioned that someone tried to kidnap her when she was a baby. Later, when I asked her family, they said that such an incident had never happened. Apparently, she had a lot of fears and made herself believe that someone was trying to kidnap her. It looked like pulsatilla, but she was drinking a lot of water. As you know, pulsatilla is thirstless. When I asked her what would be good for her, when she got scared and cried, she said consolation, and that's why I gave her pulsatilla. After the initial aggravation, she healed very well. This case was published on homeopathy.com. You can read too, and thank you.
Thank you very much, Dr. Berfin. I read your article, so it is very interesting. To all those who would like to read this publication, you can find the links in the comments at the end of the live session, so you can read all of the published cases for the e-learning diplomates. So I would like to invite, thank you very much, Dr. Berfin. I would like to invite to Dr. Nandeesh. Hello,
Hello.
Dr. Nandeesh. So
Hello.
you have, please, 3 minutes.
Thank you. So we had a case of avascular necrosis of femoral head. That means there is a loss of blood supply to the femur, and then the bone starts destructing. It was a male of 30-year-old, such a young guy. I mean, it's common in that age group, but he was a working guy. He was the only person in the family to take care of his family. It was left femur that had been necrosed. So I started taking his symptoms, and I considered at least 13 to 14 of his symptoms, as it was left side and most of the symptoms were matching. The remedy lacasis, I gave lacasis at first. Nothing helped for a month. No change at all. Then I knew my remedy was wrong. And then next I inquired further, and then the guy was shy. He was not speaking too much. There were symptoms like desire for bread, gum bleeding while brushing the teeth. So I gave mercurius. Mercurius soluble is 201 dose. That did not help too. Maybe I thought the potency was wrong, but he did not show a remedial aggravation or he did not show any change. So I thought both of the remedies are wrong. So when we get stuck in a case, what we do, we go to our master. So I asked for help from my teacher, Dr. Mahesh sir, and then he told me one thing that has made a big impact on my clinical analysis since then. Something that is very important also, that whenever you put symptoms in a repertory and make your remedy based on that, you are lacking something, you are missing something. What are you missing? You are missing the language of sickness. You are missing a study where you fail to find out from where the pathology is arising. So that was an eye-opening thing for me. And I took the case again. The same symptoms were there, the shyness, the low confidence. And then as I inquired further, he was low confident since birth. And I tried to match it with the pathology, that is atherosclerosis, lack of blood circulation. And that was surprising that the remedy Beretta carb came up, and he had aversion banana since childhood. But all these are peripheral symptoms, confirmatory symptoms. What was more important teaching was to try to find out the language of sickness. That was a big teaching, and since that day, I try to see every case in such an angle, try to understand the symptoms along with the main cause. That is, trying to understand the language of sickness, from where the disease is arising. That is most important, I think, for us as homeopaths. Thank you.
Thank you very much, Dr. Nandeesh. As I told to Dr. Aditi, and as I told to the H3 ones when I was with them, you cannot imagine how lucky you are to have to Dr. Siman, to Dr. Mahesh. We like have this privilege of learn from them, as also like H3 group have the privilege of learn directly from Dr. Atul and Dr. Latika. So thank you very much for
Thank
sharing
you.
that case with us. I would like to invite to the next guest is Dr. Snehal, but after add her to the screen, I would like to share again the screen because nobody has said the correct answer in the chat. It's not mesoreum. It is a remedy that Professor Vithoulkas has written in the Chile book, in the Chile seminars book. So it is not mesoreum. I would like to read again the. This is a remedy that has a wide range of skin condition. This is the point, especially on the scalp. And in the book, Professor writes, we see a child who is born with a very strong skin eruption, and on top of the head, she has thick crust. So it is not necessary, and I would like to also to read again the chat after Snehal. Okay, so Snehal, please, I would like to give you. Let me to give you 3 minutes are starting now.
Thank you, Maria. So there are few cases, but one case which I would say is was really instructing for me. It was a case of a teen who was suffering from alopecia areata, and she was around 11 years old, and the final treatment which the specialist advised was taking these scalp steroid injections. That was it, that and that too she has to go on that for or regular intervals. So her mom was my friend, and then she asked if I could help with homeopathy. So it's been 4 years since I have treated her, and I would say this was one case wherein I had used every possible learning from Professor Vithoulkas here, be levels of health, then acute prescribing, wait and watch. And in this case, wait and watch was the most important lesson that I learned here, because sometimes in this kind of chronic cases, you are tempted to again prescribe or repeat the dose, because you don't see, it's been 6 months, 8 months, you can't repeat the dose, you can't see any signs. But then it really taught me a lot of patience to wait and see, because I couldn't physically see the patient due to COVID restrictions and all. But it really paid off well. She's still with me in 4 years time, and right from having lot of bald scalp areas everywhere to having almost her scalp grown hairs really nice healthy. So this case gives me immense satisfaction as a homeopath, and I was very happy that I could give her that well deserved healthy and really a good life or in her that age, because it's very important. If you are a teen and you're suffering from this condition, it can really lower down your confidence. So classical homeopathy really helped me to deal with this autoimmune disease in a very patient way. And now I know that I have to wait and watch and see for the symptoms, see for any indications. Do I need to repeat? Do I need to stop? So it was really instructing and satisfying for me. Thank you, Maria.
Thank you very much, Dr. Snehal. A very teaching case. I would like to invite to Dr. Gulfisha to please give her answer. And I would like to say to the people who is writing in the chat and the people who is watching us that it is not graphitis, it is not calcarea sulfurica, it is not mesoreum. I would like to give you another keynote of this remedy. It has aggravation by oranges. Okay, so I will read the chat after Gulfisha. So thank you very much, Gulfisha. You have 3 minutes starting now.
Yes. While pursuing e-learning course, I think in 2018 there was a case, a girl, 13 year, with tonsillitis. The tonsils were so swelled, and she could not eat properly. She most probably has lose the weight. Along with that, the compression has made her voice very heavy, and she had myopia, short sightedness. Okay, so I was a very beginner at that time and giving this remedy. I then came acute. I prescribed 2 3 remedies, but she was not going well. So I took opinion of ENT surgeon, the doctor, and he said you need to go for a tonsillectomy. Straightforward, he said that. After that, I went to Dr. Vider sir. He was our coordinator, and I discussed with him. I retake the case, and we gave her a single dose of 200 potency, and her tonsillitis was really really clear. Her voice was clear, and on my surprising, she was having that myopia that was also clear. And after I met her 6 to 7 months, and she was completely a different girl, with confidence, with a clear voice. And yes, she was also going very very good in her rank. This was the case of from the primary school where I was associated, and going quite cases tonsillitis, but this was the best tonsillitis case I have seen, and that made me like I want to do this more and more. So yes, that was the best case. Yeah, Maria, thank you.
Thanks to you, dear Gulfisha. I know your feeling when you are in this position, when you see this curative process. It is wonderful, and I think this is one of the things what we are very passionate about homeopathy. We feel
Yes,
this in the people. We feel this process. We understand. So thank you very much for
thank you.
your answer. And I would like here to read the chat, because we have the first point, the correct point. The remedy is oleander. So Hanuman, you have 1 point to win the book. So I will write here. You the person who will receive the maximum the number of points will win a book, Levels of Hell, for free. Okay, so the next one is Dr. Abhishek. So Dr. Abhishek,
Hello, yes. Okay,
hello.
so
Okay, so
hello, can you hear me?
yeah, can we can hear you.
Yeah,
Mhm.
sure. So I'll discuss a case of a pan gastritis. They have done an endoscopy and they found out that it's a pan gastritis, and he was continuously on and off by proton pump inhibitors, and he has taken a couple of times a kit called H. pylori kit. It is a combination of antibiotics and proton pump inhibitors. Yet he was not able to find a special effect. As while taking this better, again as soon as he stops, there's a problem. So he came to me, and he was 35 years old, male. So when I started to look why he developed, so and I came to know that exact seat of disease by his stress level, like where it was in emotionally. Okay, so then there was some accountancy irregularity that has happened in his bank, and he's not able to defend himself to a higher authority. So I was able to look at what was his main problem. So I thought it could be a performance fear or low confidence. Then when I went to the back and past, okay, when I went to the past, and he used to have aphthosis, and exactly when before his exams. So I asked, because looking at these two things, I asked, what is your main problem? He said, I don't know, I'm not able to perform well or no. So when I asked people deep and I gave some situations, and he said yes, then I was able to find out that yes, this is a case of low confidence. That was very sure. Okay, so when I treated that low confidence, okay, I think the remedy was anacardium. All his symptoms started to become better. So he started to become his gastric symptoms started to better, and finally he had a tinea corporis, okay, tinea cruris in his near his genitalia after the treatment of anacardium. And I just asked him not to apply anything because this he had in the past. Okay, after 3 to 4 months, everything now I think it's become almost 1 year. He's free of all the symptoms. Okay, so this is what classic homeopathy teaches you to see what is the seat of the disease and what is the exact predisposition of the disease and what you need to do. And to be frank, I just copied this idea, this similar kind of case from Dr. Mahesh's clinic. So when I was there, so I mean, maybe initial stages, it's better to copy because you don't know what exactly. Then I just copied this. Okay, so even the classical homeopathy teaches us, tell the where the seed of the disease. This is what even you learned with Dr. Mahesh's teachings also. Uh, okay, thank you.
Thank you very much, Dr. Abhishek. I would like to send a greeting to Dr. Seema and to Dr. Mahesh for such wonderful students that you have trained, because you can share that excellence in the training that you have had. So thank you very much, Dr. Abhishek. And I would like to invite to the H3 group uh, clinic. So okay, Doctor Neha,
Hello.
you you have
Can you
three minutes.
Okay. I would like to share a case of my father uh, in the year 2020. He was having frequency in urination, diabetic background since 10 to 15 years, and at that time he has developed a very high grade fever. And I tried many multiple remedies, but they were not at all helping. Even we tried antipyretics, which were not able to help. Then at last, my mentors, Dr. Atul Jaggi and Dr. Latika Jaggi, has helped through the phone consultation. And Dr. Atul sir just gave one dose of natron sulf 1 m, and his energy level got better, his appetite got better, his fever got better, and there was much more improvement even in his mental emotional condition. And this case is very special for me because I seen here the live Herring's law of cure, where his ringworm was suppressed for almost 8 to 10 years. After waiting sufficiently for 8 months, he started to develop suppressed ringworms which were appearing on the skin. That means this process was going correctly. So I want to say that whenever we treat the patient correctly with the classical homeopathy, we see the beauty of homeopathy, the Herring's law of cure, which we need to see. And then when he developed the ringworm after 8 months, then there was a dose given by Atul sir, sulfur 200. And after that, his overall, he was very much better in his all level of aspect. I've shared this case because whenever our parents are suffering or when our family members are suffering, we too get anxious, and we tried many multiple uh, treatments. So I want to say that whenever we are confused, we need to switch to classical homeopathy, which will not only give you the correct way, but it will touch your soul, so that overall the patient must get better. That's it.
Thank you, Dr. Neha. Dr. Asif,
Hello, good afternoon, everybody.
Can you
Am I audible?
yeah, you are audible.
Yeah, good afternoon, everybody.
Hello, Dr. Asif. Thank you very much.
Hello, ma'am.
Okay, you have 3 minutes to share your case.
Okay, ma'am. A few 2 to 3 months back, one of my patient's father, terminal case of rectal carcinoma, was almost declared as incurable, and the hospital administration told that you better take the patient back to home and let him go peacefully. But they were insisting that the patient should be hospitalized till he gets relief. The complaint for which they came to me was his father was having severe constipation. He was in lot of agony. There was tremendous pain. He was not able to sleep with this pain, was not able to pass stool, and was being given morphine IV so that he could sleep. But as soon as he could get up again, wake up from the sleep, the same agony, the same pain, and so the son, who is my patient, he requested me that, doctor, can you do something? So I said, okay, let me try. Whatever homeopathy can help, okay, I'll try my best. So I was called for the, I was called on the visit to see the patient, and before I could ask anything to the patient directly told me, doctor, please do something for me. Every now and then I feel that I have to pass stool, I'm not able to pass, and I feel that somebody has tied my rectum from outside with a thread, and something has been lodged and impacted my anus from inside. On this information, before I could ask him anything, the remedy that struck to my mind was anacardium. Okay, I prescribed anacardium in 6C potency to the patient in repetition every 3 hourly, and after almost 6 to 8 hours, okay, the son he came and he told me that my father has passed stool, and his pain is absolutely not there, and he's just smiling. He wants to eat. He started eating, he started drinking water, and he started asking for food and various things which he liked. And after 7 or 8 days probably, this patient, he died in during his sleep, and he passed away peacefully. I just cannot forget this case because of two things. One is, as the case is of very recent origin, and second, the thing that really helped me was my recent education that I was being taking from this Academy of Classical Homeopathy.
Thank you very much, Dr. Dr. Pratiksha.
Okay. I would like to mention two cases which I saw in the clinic. The first case is of a female of a 26-year age. She has a history of PCOD, and she already consulting us since a long time. So in her one cycle, she came with the complaints of prolonged menses along with menorrhagia. So on the basis of acute totality, we prescribe the medicine, but it only show a temporary relief. So again, then we started to consider to form a complete totality. On basis of this, we prescribed her a similimum, but she got better for a while, then again relapsed back. So afterwards, simultaneously, we were calling her daily, and we were checking her blood pressure. What we noticed that every day her blood pressure is falling down. So even after prescribing on the basis of totality, then again we tried for a last time to consider a acute totality and prescribe on basis of that. But still patient overall general level, physical level, patient was deteriorating, and with this her blood pressure was falling down. So this was a point when Dr. Jaggi sir told us that you need to be flexible in such situation. So we advise her to consult a gynecologist for the acute condition, and then you again consult us. So this was the one case where I learned that we must be flexible, and we need to take a decision that means we are looking this type of cases day to day in our life. So this was one case, and the another case was, it was a case of acute case with a high grade fever, and it was a 4-year girl. And his father was a homeopath who already prescribed her 3-4 remedies, but his fever is not going down. So when he consulted us, we have taken a complete totality. On that basis, we prescribed her a remedy. After that, what we found that her fever again raised what was earlier. So, and during that symptom, we again take a acute totality. On that basis, we prescribe her a acute remedy, and after taking that, means what her father was giving her a medicine since last 1 week with a high fever, and his overall uh, generality means he has a weakness, he was cranky, irritable, and after the similimum, after a correct remedy, she get improved within a half means within a 30 minutes. So this was a learning case that what we need to find is that one correct remedy which helps her and which touch her soul deeply. And this is what we learn from Jaggi sir and Latika ma'am, that you must have that desire, that passion to learn, to listen, to observe the patient, and this is what we learn from Professor Vithoulkas. Thank you.
Thank you very much to the H3 clinic group. You're also great. A warm congratulations, and I would like to send a greeting to Dr. Atul and Dr. Latika for such wonderful students that both of them have trained, because I am completely sure of that. So I am very happy to see you all. And with these wonderful replies, we finish the second round. We will have just another third round of questions. And right now, I am going to ask the second question to win the book. The second question is: Professor Vithoulkas demonstrated that the emotional state of this remedy is characterized by a feeling of being trapped by circumstances. The patient is usually very emotional but lacks inner strength. After a period during which the patient feels unable to overcome this trap or double bind, he becomes aware of a weakness, usually beginning in the legs, symbolizing his inner inability to escape the situation. This is a neurological remedy. So I would like to ask to our audience to please write in the chat, and is the same dynamic that that we did in the last question. Okay, so we will go to our last question, to our last round about this wonderful session. And the last round is about: how do you envision the future of classical homeopathy evolving, and what are you willing to contribute to be part of that evolution? So here I would like to start with Dr. Abhishek. Okay, so I would like to invite to Dr. Abhishek. Mm, okay, it seems that Dr. Abhishek right now, here. Okay, so we cannot hear you. Yeah, now we can. You can speak. Can you hear us? Can you hear me, Dr. Abhishek?
Oh, hello. Sorry.
Don't worry. Don't worry.
Yes.
Okay,
Uh,
so you
yeah.
have
How do you?
2 minutes. Uh-huh.
Yes. Yes.
Mhm.
Okay. First of all, if someone asks, what is the future of homeopathy, they say that yeah, most of the European countries they're not so favoring. Uh, but I doubt that, because looking at least in South Asian countries like India, there's a huge way from the public. Public is already knowing what is the difference between classical homeopathy and even the regular, because the amount of relief or the pathological cases, the extent of diseases which classical homeopathy is much better. Even the public can see the difference between it. So I doubt that it will close or something will happen. No, I really doubt that. So as long as we are practicing it along with the evidence based medicine, there is no absolute problem. So yes, now what What can I do is the first and most basic thing is every homeopath or any classical homeopath should do is to see lot of cases, like tons of cases, okay, and able to solve cases and able to make some impact in their life. I think that is the first and most basic thing we all need to do first, okay, according to the principles of homeopathy. And the other thing is we need to write these cases and publish it in all the journals, okay. It could be a case series, case report, or if we have an institution, we even need to go with RCT and so on. So we need to be a parallel with the conventional medicine, no, not going against to them. We need to be parallel with the conventional medicine. That's it. Thank you.
Thank you very much, Dr. Abhishek, for that reply. I would like to invite now to Dr. Gulfisha.
Yes,
Hello, Dr. Gulfisha. You have two minutes. Okay.
sure. Uh, Homeopathy is a science that not only address the physical health but also promote the emotional well-being. Okay, so that is the only science that speak about the emotional well-being. In a way we can say the health with happiness. Okay, here I would like to share one short incident about Professor Vithoulkas. Sorry if I could take more minutes. There was a seminar, and just after entering the class, professor asked a question that what is the idea of medicine, and students and all medical doctors were giving their ideas, their answers, their replies. After listening to all of them, a professor replied, "The idea of medicine is to make people happy." I think Dr. Neha already mentioned the quote, and I'm stick to that statement. And I want to give that happiness to the patients. And with homeopathy, we have seen cases, and we have given health with happiness to the patients. And I think I'm on the right path to giving that beautiful health and happiness to the patients. Yeah. So Maria, thank you.
Thank you very much, Dr. Gulfisha, for that reply. We have to keep that in mind about this concept of health that Professor Vitulkas has given to us, because it is very important also to us as a generation to keep this in mind. So I would like to invite right now to Dr. Snehal. So, Dr. Snehal, so you have 2 minutes for this question.
Thank you, Maria. Yes, so I believe that the future of classical homeopathy and how it can evolve completely depends on us as e-learners, students, or professor students, like how we take it in a right way ahead. Because if we do it in a right way, we can pass on this legacy to other homeopath students who would be really interested in learning to it. And my part to contribute would be like I'll always be ready to learn from the cases. I always share my failures and my success with my fellow homeopaths, and I always try to make them aware about how classical homeopathy can help them in different cases. And my aim will always be to treat my patients holistically, that what we say is health and happiness. So that's a very good mantra, I would say, to remember while practicing. So the most important thing would be to practice consciously and in the most right way, and that's how we can pass on this legacy to other homeopaths and students. Thank you, Maria.
Thank you very much, Dr. Snehal. Also, it's very important what you have said about this legacy that we have to be aware that we are giving to the next generations. So, thank you very much.
Thank
I
you.
would like I would like to invite right now to Dr. Nandeesh. But before we continue, I would like to congratulate to Dr. Sankit because the remedy is Latyrus. And also, it is important to say that Latyrus has a progressive weakness of the lower extremities. So, Dr. Sankit, you have a point, and we will have one last question. uh, the last question to the audience is, who was the first who wrote, by similar things a disease is produced, and throughout the application of the like is cured? You can find this in the page 45 in the book Homeopathy and Orthodoxy of Professor George Vithoulkas. So, okay, Dr. Sakina, also you are agree, was Hippocrates. So, Dr. Sankit and Dr. Sakina. Okay, so it is necessary to one of you have another point, and we will have the next question after Dr. Nandesh. So if you have one, if Dr. Hanuman, Dr. Sanki, or Dr. Sakina um, have the correct answer of the next question, you will have a free book of levels of health for free. Okay. So please, I would like to invite to Dr. Nandesh. Hello, Dr.
Yes, Dr.
Nandesh.
Pari, yes.
You
So
have 2 minutes. Okay.
the how do I envision the future of classical homeopathy? The future of classical homeopathy looks very hopeful to my eyes as I see it flourishing in my country, that is India, and also throughout the world. And we also have our professor who is there as a light to guide us in a meta level, and also our teachers who guide us in every step of our life, uh, contributing to our practice and giving their ideas, taking us in the right path. So the hope for homeopathy is very bright, and I'm very sure classical homeopathy is going to flourish in coming years. And what we can do as classical homeopaths is try to treat as much cases as possible. Especially we stay in countries which are highly populated in like countries India, South America, Mexico. So we can treat as much cases as possible and document our cases, even if it's a success or even if it's a failure. When we start documenting, we can learn by ourselves what went wrong in the case. If it is a failure or if it is right, if it is a right case, then it would be a guide or a study material for others also. And also we have to write in platforms such as Twitter, make a short form content or long form podcast in YouTube and upload in Spotify, so that now the social media is having a great reach throughout the world. So why not propagate the ideas, right ideas of classical homeopathy through the world? And I really appreciate the effort that Maria Fernanda is taking to propagate the ideas of classical homeopathy with this YouTube channel. So when we take a holistic approach with the treatment as well as promoting the homeopathy, the future looks very bright. Thank you.
Thank you very much for your words, Dr. Nandish. It's actually a teamwork that we all have to do as a generation to make sure that homeopathy will bright in this way, and will have this inner light of homeopathy that is inside of us. So thank you very much for your reply. And right now, I would like to invite to Berfin to please give her answer. And but before add to Berfin to the screen, I would like to invite to Dr. Hanuman, Dr. Sanki, and Dr. Sakina to please the first one of you that reply this correctly will win a book of levels of health. So, in which aphorism of Organon is written the law of similars. Okay, so I will give you a few minutes, and after Berfin, I will read the chat. Okay, so please, Berfin, you have 2 minutes starting now.
Okay. Traditional medicine is helpless for many diseases. As patients heal with homeopathy, they will understand that the real healing is not eliminating the symptoms as traditional medicine does, but providing mental, emotional, and physical well being. That's why I want to cure as many difficult cases as possible, prepare more articles with the help of the academy, and show the power of classical homeopathy through published articles. I know I always say publish articles, but it is very important, I think. So that's all.
Thank you very much, Berfin. I am totally agree with you, and we have to show the cures. We have to make this effort in order to see a better, and not a better, a bright future, a future when in which homeopathy is more free. So thank you very much. I would like here to invite to Dr. Aditi to please give her answer. So, Dr. Aditi, you have 2 minutes.
Yes, ma'am. So the future of classical homeopathy definitely looks promising for me as well. What I feel is a cure found for a previously incurable condition in conventional medicine. Like, don't you think it would make it to the news headlines? But similarly, when classical homeopathy is able to cure, and there's an impressive record of cures of previously deemed incurable cases being cured by classical homeopathy. Even against such overwhelming evidence, which is truly remarkable, sometimes I feel like the medical authority or the community are just ignorant about homeopathy. Two main reasons could be, one being we don't have enough good quality case reports, and the second one being we don't have enough double blind trials. About the first one we could do something, but about the second one, I personally feel that it's a waste of time and money and energy to attempt demonstrate the effectiveness of homeopathy through RCTs and double blind trials, because as a physician you yourself can know that you cannot really be blinded in the real sense from the observations that you get after giving a remedy. I mean, you clearly know that when you give a remedy you have a set of observations, and you know that you have given a remedy, whether it's close, it's simillimum. But when you give a placebo, you know what to expect. So in the real sense you really cannot do double blind trials. However, the only evidence that homeopathy can present to the scientific world at this moment are these thousands of cured cases. So I have 2 point of views. One is to meet the demands of the scientific community. We as homeopaths should take up all the responsibility to document quality case reports under the care guidelines, which Seema ma'am was mentioning earlier, so that there's good enough evidence for the scientific journals to recognize homeopathy as a standalone. And my second point of view is for the common people and the patients. There's not enough awareness about homeopathy, and also even if they are aware, they are misguided by what's available online. So me as a homeopath, as a budding homeopath, I would definitely pledge to document good quality cases and to practice homeopathy in its purest form, so that the future should be good for homeopathy. And also I would like to create good quality content for the common people out there. So that's how I would like to contribute. Thank you.
Wonderful. Thank you very much, Dr. Aditi. Thank you for that answer. And here I would like to invite to the H3 group to finish this third round. And also here I would like to congratulate to Dr. Hanuman, because the correct paragraph where Hanuman says writes about the law of similars is the paragraph 26. So congratulations Dr. Hanuman, because you have won a book of levels of health, please write your details to a community at vithoulkas.com. So we will send you to you the book. So I would like to invite here to the H3 group. So I would like to invite to Dr. Ravi. Hello, Dr. Ravi.
Can you hear
I,
me?
Yeah, yeah.
About your question about the future of classical homeopathy.
Okay.
Yes, about the question, the first thing I will say that there is only one way to practice homeopathy, and that is classical homeopathy, through classical homeopathy, because only through classical homeopathy we can observe the real cure, or we can see, we can produce the real cure, what Hahnemann mean to be. And because only in classical homeopathy we see the patient as a whole, and we apply the theory which the Hahnemann taught us, and we see the results. We follow the case for a longer period. We treat the chronic case as well as the acute which are coming with the chronic case. So as long as we could do this, we could able to do this, there will be results. And that's why I see a very bright future for classical homeopathy in the future. And uh, the other thing what you said about how I will contribute to this part is I will contribute through making people and the students, new students, aware that what real classical homeopathy is, and I will make them aware how to learn it, especially with the teachings of George Vithoulkas and the academy. That's it. That will be my part, to make them aware in the future that about the classical homeopathy, how to learn and how to produce the results. Also, there is a quite much increase in a deep constitutional diseases, deep pathological diseases, uh, which will increase in the future, and also there is an increase in a high class acutes. So the conventional medicine also doesn't have answer to it, and classical homeopathy is the only thing which can answer to this. So it has a bright future in the ahead. Thank you very much.
Thank you very much, Dr. Ravi. Um, Dr. Kancham.
Am I audible there? Should I speak? Thank you so much for this opportunity. I would like to present my opinion here regarding the future of classical homeopathy. As we all of have learned with our beloved professor regarding the classical homeopathy, he has put forward the concept regarding the level of health, like which we don't have in any other system of medicine. So we learn here regarding the level of health. We can prescribe it accordingly. Like any disease can be present in any level of health. Like these kind of things. This was just an example. Like we knew these. This was only given by Professor George Vithoulkas, and not any other system of medicine. Second thing, like contributing to this evolution, like we would like to explore many more things by keeping a record of our cases, by clinical experiences, by spreading this knowledge of homeopathy, this divine science which have helped healing, healing in a very beautiful way, like making people experience regarding this curative process, to the extent that like they will be happy from their heart. Like it's good to see people being happy from their heart, from their soul. Also, like we, Dr. Dr. Jaggi and Dr. Latika ma'am, we are here with them learning homeopathy in a classical way to give the tremendous curative and healing power of the medicine, so that we can see our patients happy. Uh, Dr. Also, Professor George has started this journey. We are very happy to be a part of this journey, to put forward his concept regarding health, and
curative process, and the action of medicines to make people happy in future.
Thank you,
Thank you,
Dr.
Dr.
Kancham.
Kancham.
Dr. Asif?
Dr. Asif?
Hello once again. Good afternoon, everybody. A classical homeopathy truly represents the exemplary standard of the traditional and long-standing homeopathy of 200 years as advocated by Professor George Vithoulkas and taught by Samuel Hahnemann and Dr. J.T. Kent. As for the future of homeopathy, what I see, because of classical homeopathy, people will have the first choice to choose for that treatment will be classical homeopathy, and I see that conventional medicine would come and stand on number 2. This is my dream also, as of most of the diplomats I have heard from the academy. And the third part is I would like to contribute here to by practicing as a practitioner of classical homeopathy and by spreading this classical homeopathy in the students and the future homeopaths by giving them the idea of joining the e-learning course, which is I think, the most easiest way to learn classical homeopathy, which is being advocated by our beloved Professor George Vithoulkas. Thank you so much.
Thank you.
Thank
Thank you
you. Thank
very
you very
much.
much.
Uh,
Uh,
Thank you to the H3 group. It is wonderful to see you all. I am very happy for all of the things that all of you have shared with us, the H3 group, and all of the participants that we had today. And to finish this wonderful session, I would like to please invite to anyone who would like to participate to say what does the e-learning program of Professor George Vithoulkas mean for you, and what would you say to a young person motivated to study homeopathy? So here I would like to invite to anyone who would like to participate. If in the H3 group somebody would like to participate,
participate.
um,
Anyone wants to come?
anyone.
Anyone?
Okay. Hello, Maria.
Come,
Hello, Dr.
hello,
Rafi.
Dr. Rafi. Yes, yes, you start. Nidhi will also start.
Okay.
You go back. Nidhi will.
As you know, I want to share that I am doing it the second time. The e-learning course. I have done it in 2012 to 2014 with Atul sir and Latika ma'am. So I find it the most scientific course after my education, because I was in a search of a course which should be scientific, which can give me a proper career, which helps in my career, building my career. So this course has been helping me a lot. I will say whatever the patience and the success I have seen in these 10 years is because of the e-learning course, one thing. And the second thing, because the learning is so proper in e-learning, it covers every kind of information related with the medicine as well as with the homeopathy. It covers theory part, it covers mathematical parts, repertory part, the proving part, the cases part, and the follow-up of the cases part, the analysis of a case. So it covers A to Z part of homeopathy and the medical science. That's why if we learn it properly, we can use it in our clinic and produce good results, and we can build our future. So I will request everyone to take this course, because it will build your future. That's it I want to say, and my colleague will follow.
Yeah.
Thank you.
Okay,
So hello.
Nidhi,
What I
and
would,
tell yourself.
yeah, I'm Dr. Nidhi here. I would like to put forward my view that I have myself experienced. We are already all the graduates over here. We have learned homeopathy from our colleges for almost 5 years, which what we saw in the college time, and I think everybody would agree, during the clinical practice in the college that we saw, there was more repetitions of medications. There was no waiting. What I learned from this course from George sir is the importance of waiting and to see what reactions the remedy produces over a period of time, and how there are the layers of cases coming out after waiting for a proper period of time, giving time for the remedy to work out. That is what I see different from normal homeopathic learnings. And the other thing that Dr. Ravi said, we only in this course, I think we see a chronic management of cases. Whereas there, otherwise in the, I think so everywhere in the world where homeopathy is being taught, there is repeated repetitions of medications without waiting for an accurate period of time and giving time for the medicine to work out. So this is what is important for me currently, to manage a chronic case and to wait properly to see all the reactions.
Thank you very much to the H3 group. And again, congratulations to Dr. Atul and Dr. Latika for such wonderful, wonderful students. I hope that all of the audience that is watching us today can see the quality of the education that you are receiving. So thank you very much. I would like to invite to Dr. Aditi and finally to Dr. Berfin.
Yeah.
Hello, Dr. Aditi.
Hello, ma'am. So in India, for us, studying BHM is the a degree of homeopathy is like 5.5 years, and I got introduced to e-learning program in the second year by Dr. Seema ma'am. So until then, whatever I learned about homeopathy was so boring, and I was not able to understand. But e-learning program really opens you up into a whole new level of homeopathic principles and knowledge, and to really practice it in its purest form. So e-learning program offered by Professor Vithoulkas is your one-stop destination to understand materia medica, science of homeopathy, levels of health. He also gives cases to support what he's teaching. So it's the most scientific way of teaching that's available currently. And I would also like to say that there's so much success that I have seen and also I've witnessed by just employing what is being taught in e-learning program. And I would also encourage my fellow homeopaths to take up e-learning program, apply what's being taught, and each time we see these videos, our knowledge deepens more and more, and it grounds you more and more. So I would definitely encourage everybody out there who's studying homeopathy to take up e-learning program. And I would like to say that everybody should be able to what to say employ what they are learning, and treat patients, make them feel better, and also document those cases. And if you feel that it's good enough, please send it to research@vithoulkas.com, where Seema ma'am will be taking it ahead, and she'll be doing it. So thank you for this opportunity, ma'am, and I'm really grateful to Professor, to my mentors, to you for providing me with this opportunity.
Thank you. Thank you very much to you, Dr. Aditi, and also thank you to Dr. Seema Mahesh and to Dr. Mahesh, because of such quality as the H3 group. Also, I can see very profound knowledge of homeopathy in all of the students of Dr. Seema Mahesh and Dr. Mahesh. So thank you very much, and we finalize this third and the last round of this live session with Berfin.
When I decided to study homeopathy, the only thing I knew about homeopathy was simile muscurantur. I had a baby, you see on the photos, to take care of, and therefore online courses were my only option to learn homeopathy. While searching on the internet, I saw the Academy's e-learning course and I sent my application immediately. I learned what I know about homeopathy all from Professor George Vithoulkas. That's why I was never confused and I was always able to move forward with firm steps. Many people in Turkey who have received training elsewhere apply to receive training from Professor Vithoulkas because they say that what they have learned is not enough for them to cure the patients. Vithoulkas has a pleasant narrative style and the lessons are very entertaining and memorable. I admire how Vithoulkas tries to spread this divine knowledge for the benefit of the mankind. I'm so grateful to be a part of this family. Thank you for giving me this opportunity. Very thanks.
Thank you. Thanks to you, dear Berfin, and thanks to all the participants. To I would like to all of you to please turn on your camera to say goodbye, and I would like here to okay. I would like to say that this was an incredible journey that we have today. That we had today. Thank you very much for joining us in this very important live session, and for share this with us to all the people who is watching. This was a very important live session, and
And
also
also
thank you.
thank you.
Uh,
Uh,
uh, Sorry, we had a echo in the H3 group, but I think that right now it's okay. So thank you very much for joining us in this important session, and thank you to the young homeopaths and to all the homeopaths that today were with us. And a huge thank you to our amazing guests for sharing their experiences and all their passion, and also to all those who are considering homeopathy. I would like to please to say to the people who is watching to share this with all those people who would like to study homeopathy. And your voices today have added an important resonance to the global conversation of these beautiful science. To our guests, to Dr. Aditi, to Berfin, to Dr. Gulfisha, to Dr. Snehal, Dr. Nandeesh, to the whole team of H3 Group, to Dr. Abhishek, and to all of you that are watching to us today. I am very grateful. Don't forget to hit the like button, subscribe to our
subscribe to our
channel
channel
for more
for more
content.
content.
Again,
Again, the
okay. So subscribe to our channel for more content like this, and share this video with anyone you think might be inspired and interested by the world of classical homeopathy. Let's continue this dialogue until we meet again. And I
and
would
I
like
would like
Maria?
to.
to
Yeah.
yeah.
Yeah, I would like to thank from behalf of everybody of us on putting forward such efforts and such a beautiful platform for all of us to show our views regarding homeopathy and to promote it through this.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank
Thank
you.
you
Thank
very
you
much
very much.
to all of you. And I would also like to ask to our participants if you would like to say something to say goodbye.
Uh, Thank you,
Thank you,
Maria, for
Maria,
this
for this
opportunity,
opportunity,
and thank
and
you to
thank you.
the Classical International Academy of Classical Homeopathy. It was lovely to interact with everyone and take it from here, pass on the right thing everywhere to create awareness. Thank you so much.
Thanks to you, Dr. Snehal. And
And
sorry,
sorry,
Dr.
Dr.
Latika, I
Latika,
had
I had
to
to
turn off
turn
the
off the
microphone because
microphone
there is
because
a
there is
echo.
a echo.
Okay.
Okay. Thank you. Yes.
Thank you. Thanks to you. So We see you next time. I am sending to all the audience and to all the people who was participating in the chat. I would like to send a big hello to Naturephilia. She says amazing interacting session by Dr. Maria. It was worth attending. So thank you very much to all the participants. See you in the next live session. Thank you very much.
Okay. Thank you. Thank you.
Thank you.